TB has always represented a great problem, a health problem, epidemiologically speaking and socially speaking, because TB has represented the differences between the rich and the poor in Brazil. And so it is still a very relevant, I would say, epidemiological problem in the country, although we are investing more and more, and we are seeing good outcomes in terms of tuberculosis decreasing. In terms of incidence and prevalence, and in terms of social investment. Brazil, as you know, economically is in a very, I would say, better situation compared with 2 decades ago, or even with 1 decade ago. And so tuberculosis, in a certain sense, is influenced by all these social changes. Actually, it did sensitize me a lot, because I could feel that tuberculosis represented all the social inequalities, the lack of access of these patients to the health, to the good health and humanized assistance. And so it did, in a certain sense, represent all the social difference that Brazil had at that time. So if we do invest in providing good access for the patients, if we can reduce the distance between rich and poor, so poverty and richness in Brazil, so access to services, access to diagnostic and to good treatment, so certainly Brazil will be, this is what we are hoping a lot, that Brazil could be out of the list of the 15 highest burden tuberculosis country in this next 4 or 5 years. Oh yes, so to find a shorter diagnostic timing. So this is something that really brings a great problem for tuberculosis control. The diagnostic that we are still using is smear. Smear is something used for more than 1 century. So we have to find molecular means to make diagnostic an immediate one. The second issue, which I do consider as fundamental, is reducing time of treatment. Even being college short course therapy, we cannot treat tuberculosis for less than treating less than 6 months. So this is something really difficult to keep a patient adhered to a treatment, taking pills, lots of pills, even using fixed dose combination. He or she has to have to take at least 4 pills a day, every day. So we have to find out shorter treatments and more efficient ones. So these are the 2 main lines in which all the non-governmental agencies, the funders, and the governments have to be committed in searching for. We have to find out new compositions of drugs, providing shorter regimens for treating sensitive cases, as well as more effective regimens for treating multi-resistant TB, which is a great problem, as you know, and more effective in terms of outcome. Because this is a problem. We have 2% of the whole number of cases in the world are multi-resistant, and so although our country does not present a very severe problem in terms of multi-resistant, but we do realize that we have to participate in all this research in terms of, in order to find out better regimens to treat this form of tuberculosis. Although all the problems we have in Brazil, I would say that we have been a good example in terms of tuberculosis control. We have reduced our incidence. We are consistently reducing annually. We have reduced a lot our mortality. We are participating in international researchers in terms of new diagnostics and new treatments. And in addition, we have always used, since the implementation of the short course therapy 30 years ago, we have been using rifampin and isoniazid in the same capsule. So it certainly avoided the monotherapy, which is a problem, and irregularity, which is a very severe problem for tuberculosis adherence and adhesion and in treatment. And so this is something that really contributed, as at least for our country, a lot in terms of controlling multi-resistance.